Muscat Endoscopy Academy. In this video, we're going to be going through pre-procedure scope setup. Some might think that this is not very relevant, but I will argue otherwise, as it is important for every endoscopist to understand the tools that we're using and all the accessories that are involved. We begin by removing the endoscope from the drying cabinet. Notice how it's stored hanging, and this position keeps it dry, prevents kinking, and ensures the insertion tube is always ready for use. From the very first step, careful handling is what guarantees both patient safety and longevity of our equipment. Now, accessories are gently separated. This includes valves, caps, and connectors. Never force them apart. Small pieces are delicate, and damage here can lead to big problems during live procedure. As the scope is placed into the tray, you'll notice the circular motion. This is not just a habit, it's intentional. By placing the scope into gentle loops rather than straight folds, we protect the internal channels from pressure points that could cause hidden cracks. And one of the most important stages is preparing the accessories. Each item has a specific role: suction valve for clearing the field, air valve for insufflation, the biopsy cap for tissue access, and flushing tubes for irrigation. We transport the scope to the room, and we also prepare the antiseptic enzymatic solution to be used right after procedure. Next, we attach the scope to the tower. The connection begins with the scope key. Listen to that reassuring click, and the sounds tell us that the system is secure, and the scope head is hung on the stand so it's stable and not resting on the floor or table. Then one by one, we connect the tubing. First suction, ensuring fluids can be evacuated. Then the CO2 bottle, tied firmly so it doesn't wobble or fall during use. And finally, a flushing bottle, which will deliver irrigation when needed. And this order matters here. It's systematic and repeatable, reducing the chance of error. With all the connectors in place, we power on the tower, the system boots up, and the scope is activated, ready to go. CO2 is engaged first, providing the safest insufflation for the patient. Thereafter, we turn on the suction, ensuring fluid removal is functional, and these two always go hand in hand. Before handing over the scope to the doctor, we perform the final checks. 3 points must always be tested: suction to confirm the lumen is open, air to confirm insufflation, and flushing tested with the foot pedal to confirm irrigation is smooth. It's like a pre-flight safety check, really. Everything must work before takeoff. And with that, the scope is fully ready, and we can hand it over to the physician. In the next step, we will be discussing post-procedure scope reprocessing, which is a process that is quite unfamiliar to most endoscopists, and where many mistakes may happen that could potentially damage the scope irreversibly. We start by wiping the insertion tube from end to end. This removes surface debris before it can dry and become harder to clean. Immediately, the air and water valves are replaced with clean ones, and the biopsy channel is flushed. Acting quickly at this stage prevents secretions from sticking inside the scope. By pressing the channels at the same time, we push out any remaining waste or blockages. Think of it as giving the channels a quick rinse before the real cleaning begins. Once that's done, the scope and tower are switched off, and each connection, suction, tubing, CO2, and flushing pedals is carefully detached. This protects the equipment and prevents leaks or spills. The scope is now removed from the tower. Contact points are wiped with sterile cloths to keep surrounding area clean. The scope is then transported directly to the cleaning room. Timing matters here. Before handling the scope further, the nurse puts on full protective equipment: gloves, gown, mask, and eye protection. This is essential because reprocessing is the stage with the highest risk of exposure to biological fluids. Meanwhile, about 7 liters of warm water are prepared. kept between 30 and 40 degrees. This is the optimal range, warm enough to loosen debris, but not so hot that it could damage the scope. The first technical step is leak testing. The leak tester is attached, the scope is gently pressurized, and then submerged into clear water. Here, the nurse carefully watches for bubbles rising from the surface. Even a tiny stream can reveal a hidden crack. That's why no detergent is added yet. Detergents would create foam and mask the bubbles, increasing the risk of missing a leak. If no leaks are detected, the scope is removed from the water, the tester turned off, and the pressure released. Only now it's safe to move on to manual cleaning. This is the single most important stage of reprocessing. This is where freshly prepared enzymatic detergent is used, and it must be new for each scope, never reused to prevent cross-contamination. All channels are flushed and every detachable part is brushed thoroughly while the scope remains submerged. Working underwater prevents splashing and protects the staff. The nurse uses soft channel-specific brushes to clean inside the suction valve, the air valve, and water valve, the biopsy port cover, and every opening, as you can see here on the video. Each pass of the brush is checked, coming out of the specific and designated end of the scope, and this will continue until no debris is visible. After brushing and flushing, the scope is rinsed with clean water to remove detergent, purged with air to clear moisture, and dried with a soft, lint-free cloth. This prevents dilution of the high-level disinfectant that comes next. Finally, the scope and its valves are placed in trays and loaded into the automated endoscope reprocessor. Channels are closed, the lid secured, and the cycle is started. This ensures high-level disinfection according to strict manufacturer standards. About 45 minutes later, the cycle is complete. The scope is removed carefully, dried again if needed, and hung in the storage cabinet with all channels left open. This keeps air flowing through the instrument and prevents moisture buildup. At this point, the endoscope is fully reprocessed, safe, and ready for the next patient. Thank you very much for paying attention. Hopefully this was helpful for nurses and doctors alike.